Imagine for a second that you could reach into the human brain and hit a literal factory reset button.
A factory reset.
Yeah, like a button that just instantly erases the physical agony of drug withdrawal and silences the relentless psychological cravings of addiction, all while untangling years of severe trauma, in a matter of hours.
On its face, I mean, it sounds like complete science fiction.
Or maybe just another one of those overhyped medical trends we see all the time.
Exactly. And extreme skepticism is really where we should start with this. Because in the medical world, whenever a single intervention promises to resolve multiple deeply complex neurological issues all at once, your default response has to be a demand for rigorous data.
Right. Show me the numbers.
Bruh.
And that data is exactly what we are digging into today. We have a seriously fascinating stack of sources to go through for you.
It's a huge stack.
Yeah, we're looking at a highly detailed, multi-year thread from the ExcelMale Health Forum, plus these deep dive clinical reports coming straight out of Stanford University.
Not to mention the webinar transcripts from frontline clinicians.
Right, people who have overseen thousands of these treatments. And to top it off, we have breaking policy news from just a couple of weeks ago, in April 2026.
So our mission for this depth dive is to synthesize all of this. We really want to understand the trajectory of a very specific, incredibly powerful substance.
Yeah, we are going to trace how a sacred African root transitioned from, an underground, often stigmatized treatment for addiction all the way to the absolute center of a billion-dollar pharmaceutical race.
And what advocates across the political spectrum are now calling an emancipation mission.
Right, an emancipation mission. But just to be clear up front for you listening, while the headlines tend to use the word miracle, the science reveals a deeply, deeply complex biological and psychological intervention.
Yeah, it is not magic at all. It's heavy, heavy neuroscience.
So to understand where we actually are in 2026, we really have to start with what this substance is. Like, where does it even come from?
Right, so we are talking about Ibogaine. It's a naturally occurring psychoactive alkaloid. And it's primarily extracted from the root bark of a shrub called Tabernanthia iboga.
Tabernanthia iboga.
Exactly. This plant is native to the rainforest regions of West and Central Africa, so specifically places like Gabon and the Congo.
And they've been using this for a long time, right?
Oh, for millennia. Communities in that region, particularly those practicing the Bwiti religion, have used this root for 3 very specific ceremonial purposes.
Which are?
Initiation, the transition from adolescence into adulthood, and deep introspection.
Wow.
Yeah, we are talking about a really rigorous 3-day journey where the individual is meant to confront their shadow and understand their place in the world. It is a profound cultural touchstone for them.
So it's not something taken lightly.
Not at all. In its original context, it's treated with immense reverence. It is not a recreational substance. It's basically a sacred tool for navigating the most difficult transitions in a person's life.
Right.
And it remained very closely guarded within these spiritual lineages for a long, long time, until a completely serendipitous event in 1962.
Right, the Howard Lotsof story. This is wild. So Lotsof was a 19-year-old American living in New York, and he was unfortunately addicted to heroin.
Just 19.
Yeah, just 19. And a chemist friend gave him a dose of Ibogaine. Lotsof takes it, probably just expecting, a standard 1960s psychedelic trip.
Sure.
He goes through a very intense experience, goes to sleep, and wakes up the next day to find something literally impossible. His physical heroin withdrawal is completely gone, and his psychological cravings have just vanished.
He stumbled onto a profound physiological reset mechanism just completely by accident.
It's incredible.
And he spent the rest of his life advocating for its medical development, trying to get researchers to take his accidental discovery seriously. But to really grasp why his finding is so monumental today, we have to look at the reality of the current crisis in addiction treatment.
Yeah, because the numbers in these clinical reports are just grim.
Yeah.
The current rehab model in the U.S. is largely built around symptom management.
Right.
If someone is dealing with opioid addiction, the standard of care usually involves treatments like methadone or Suboxone.
Which are opioids themselves.
Exactly. They are used to manage the physical cravings and keep the patient stable, but they fundamentally keep the patient dependent on a substance.
Yeah, Brian Hubbard, he's the CEO of Americans for Ibogaine. He describes this as a system built on chronicity.
Chronicity.
Right, meaning it's an entire industry designed to manage suffering indefinitely rather than actually resolving the underlying issue.
And so expensive.
It's incredibly inefficient. Traditional inpatient treatments for severe addiction can cost upwards of $100,000 for a 120-day stay, and the data shows they carry roughly a 75% failure rate.
Okay, let's unpack this for a second. It sounds like the current rehab model is basically just putting a bucket under a leaky roof.
Yeah, just catching the drops, whereas Ibogaine operates more like a plumber, actually going into the walls and fixing the pipe.
I like that analogy.
It's an interruption model rather than a maintenance model, and we actually have decades of real-world data on this from outside the U.S.
Right, like in Brazil.
Exactly. In Brazil, Ibogaine is unregulated, and it's utilized as a medical treatment. Dr. Bruno Rasmussen has administered over 2,500 treatments there since the 1990s.
And looking at his clinical outcomes, it's wild. He's reporting success rates exceeding 70%. And that is specifically for stimulant addictions, like crack and cocaine.
Which is a massive data point because right now there is currently no FDA-approved medication for stimulant dependence.
You can't just prescribe a methadone equivalent for crack cocaine.
You really can't. Which is why you see this push being framed as an emancipation mission. It's a movement aimed at rehumanizing addiction treatment.
Getting people off the treadmill.
Right. The goal is to free people both physiologically from the chemical hook and psychologically from the trauma loop, rather than keeping them endlessly cycling through a monetized healthcare system.
Okay, but if it's acting as the plumber and fixing the pipe, we need to understand the mechanics here. How does a root extract manage to reset the human brain?
Well, this is where Ibogaine breaks almost all the rules of traditional pharmacology.
How so?
Most psychiatric drugs are designed to be magic bullets. They are engineered to hit one, maybe two specific receptor targets in the brain just to minimize side effects. Ibogaine, on the other hand, relies on what researchers call polypharmacology.
Polypharmacology. So it's hitting multiple targets.
Exactly. It simultaneously hits more than 10 different neurotransmitter systems.
Wow, 10. So it's hitting serotonin receptors, which govern mood. It's hitting dopamine pathways, which, drive the addiction reward loop.
Right. And it binds to opioid receptors, which handle the withdrawal and pain. Plus, it interacts with NMDA receptors, which control habit formation.
It's essentially forcing a neurological symphony.
That's a great way to put it. And the most crucial player in that symphony is actually a secondary compound. When you ingest Ibogaine, your liver metabolizes it, converting it into a new compound called Ibogaine.
And Ibogaine is the really long-lasting component, right?
Right.
Because the pharmacological data shows it stays active in the system for anywhere from 24 to 50 hours.
Yes. Its effects are what make that withdrawal interruption possible. Ibogaine acts as a partial opioid agonist.
Meaning what, exactly?
It means it binds to the brain's opioid receptors just enough to ease those excruciating physical symptoms of withdrawal, very similarly to how methadone works.
Right.
But, and this is key, it does this without activating the reward center that actually reinforces the addiction.
Oh, wow.
And simultaneously, it acts much like an SSRI antidepressant. So it boosts serotonin levels to stabilize the patient's mood during a highly vulnerable period.
But it goes even further than just mood stabilization, right?
Yeah.
Because Ibogaine is classified as a psychoplastogen.
Yes, exactly.
Meaning it triggers the release of specific neurotrophic proteins in the brain. So think of these proteins as a highly concentrated fertilizer for your neurons.
That's spot on.
They promote the rapid growth of new neural connections, essentially repairing the physical neural circuits that have been degraded by years of chronic substance abuse.
And we can see this repair process in action in the MISTIC trial. This was published by Stanford University in 2024. It was a landmark study in Nature Medicine.
Yeah, I read through this one. They took 30 male special operations veterans, right?
Right. And these were individuals dealing with mild traumatic brain injuries from repeated combat blast exposures. And that was compounded by severe treatment-resistant PTSD.
And on average, they were 8 years post-discharge.
8 years.
That is 8 years of broken sleep, hypervigilance, and trying literally every conventional therapy and medication available without finding any relief.
Yeah. So they put these veterans through the MISTIC protocol, which involves a single dose of Ibogaine combined with intravenous magnesium to protect the heart.
And when I looked at the clinical results of that study, I genuinely had to reread the data. The effect sizes were just massive.
They really were. Just to put the results into perspective for you, in psychiatric research, effect sizes are measured by a metric called Cohen's d.
Okay.
If a new antidepressant hits a score of 0.8, researchers consider that a large, highly successful effect.
0.8 is great.
Right. The Stanford trial saw a Cohen's d of 2.54 for PTSD and 2.8 for depression.
I mean, those numbers are almost unheard of in the psychiatric literature. And the 12-month follow-up showed an 84% probability of sustained PTSD remission.
Yes.
Plus, because of that magnesium drip they used, they had 0 cardiac events during the treatments.
But documenting that the symptoms vanished is really only half the puzzle here. To understand why they vanished, we have to look at the brain's actual operating system.
Right.
A follow-up study was published just a few weeks ago in March 2026 by a Stanford researcher named Kenneth Shinazuka.
Yeah, this is the EEG study.
Exactly. His team analyzed the veteran's EEG brainwaves before and after treatment using a novel mapping method called FREQness. It basically visualizes whole brain networks in real time.
And they observed a phenomenon they termed a posterior shift.
The posterior shift, yeah.
So in a brain suffering from severe PTSD, there is a massive overproduction of high beta waves. We're talking around 24 to 25 hertz, and they are concentrated in the frontal lobes.
Right. And that frontal region is responsible for maintaining rigid beliefs, predicting outcomes, and detecting threats.
So when you have severe trauma, that threat detection system basically gets locked in an on position.
Totally locked. The brain is holding steady in this state of exhausting hypervigilance, just constantly scanning the present environment for the dangers of the past.
Here's where it gets really interesting to me. It sounds like a computer's firewall that is stuck on a red alert setting, actively blocking any new contradictory information from coming in.
That's a perfect analogy.
Right. Even if the veteran is sitting safely in their living room, the firewall rejects that safe data. But after the Ibogaine treatment, the EEG showed those high beta waves shifting away from the frontal lobes and moving to the posterior regions, the sensory areas at the back of the brain.
And the study also measured a 15% reduction in what is known as cortical coupling.
Which are the rigid established pathways within the cortex, right?
Exactly.
So it's temporarily lowering that overactive firewall, allowing the brain to finally download a safe update from its present environment rather than running on the corrupted code of the trauma.
Yes. And that aligns perfectly with a leading neurological theory called the RBS model.
RBS.
Right. It stands for Relaxed Beliefs Under Psychedelics. The idea is that the brain is fundamentally a prediction machine. It uses past experiences to guess what will happen next.
Makes sense.
Trauma creates rigid, terrifying predictions. By shifting control away from those threat-detecting frontal regions and relaxing the established neural pathways, Ibogaine stops the brain from filtering the present moment through the trauma of the past.
Wow.
Yeah, it allows the patient to perceive their current reality without that defensive filter.
We have a substance that interrupts withdrawal, fertilizes new neural pathways, and essentially reboots the brain's threat detection firewall in less than 36 hours.
That's the summary, yeah?
The natural question anyone listening to this would ask is, why isn't this standard protocol at every rehab clinic in the world right now?
Because the catch is incredibly serious. Ibogaine has a fatal flaw.
It's cardiotoxic.
Highly cardiotoxic. Specifically, it inhibits potassium channels in the heart, which causes an electrical delay in the heart's reset cycle between beats. In medical terms, it prolongs the QT interval.
And that's dangerous.
Very. In susceptible individuals, or if it is mixed with certain other medications or drugs of abuse, this delay can trigger fatal heart arrhythmias.
Which perfectly explains why Dr. Rasmussen in Brazil runs such an incredibly strict operation.
Exactly. He originally got into this field in the 90s specifically to save a family member who is addicted to crack cocaine, and he has overseen those 2,500 treatments with 0 deaths because he absolutely refuses to treat anyone without rigorous EKG screening.
EKG, comprehensive blood work, and a clinic setup that is literally right next to an ICU.
Right. There is 0 room for a casual or drive-through mentality with this substance. Underground or at-home use carries an immense risk of death.
Yeah, you can't just take this casually.
And beyond the physical dangers, the treatment experience itself is intensely demanding. It unfolds in 3 distinct, grueling phases.
Right, let's go through those. The first is the active phase, which lasts anywhere from 1 to 8 hours.
And the clinical reports describe this as an intense wonderogenic state, basically a waking dream state.
So patients experience these vivid, rapid-fire, biographical hallucinations.
Exactly. Often replaying childhood memories and deeply buried traumas. And physically, there is severe nausea and a complete loss of physical coordination.
Then the patient enters the reflective phase, right? From hours 8 to 20.
Yeah. The rapid-fire visions fade out, and they enter a state of deep, quiet introspection. This is where the brain begins processing the sheer volume of emotional material that just surfaced.
And finally, there is the resolution phase from hours 20 to 36.
Right, where the patient emerges feeling physically exhausted but remarkably clear-headed. And crucially, Without the physical cravings, they may have battled for decades.
But it's really important to note that the chemical reset alone is not a cure.
No, absolutely not.
The webinar transcripts from these frontline clinicians constantly stress that psychotherapy integration is mandatory. Like, Dr. Rasmussen will not accept patients who refuse to commit to extensive follow-up therapy.
Yeah, the chemical intervention clears the foundation and opens a window of neuroplasticity, but the patient still has to do the psychological work of building a new house.
Aside from the medical and psychological hurdles, there's also a massive ecological and ethical crisis attached to this route.
Yeah, this is huge.
The explosion of global demand for Ibogaine treatments has led to rampant illegal poaching of the Tabernanthe iboga plant in Gabon.
Which is a direct violation of the Nagoya Protocol.
Right.
That's an international treaty designed to protect genetic resources and ensure fair benefit sharing with indigenous communities.
It raises a very familiar, deeply concerning ethical question. Are we just swooping in, taking a sacred indigenous cure, commercializing it for Western clinics, and potentially wiping out the rainforest in the process?
It's a crucial point. If this treatment is going to scale and become morally sustainable, it simply cannot rely on extracting wild plants from Central Africa.
So what's the alternative?
Well, legitimate medical providers are already shifting their supply chains. Many now utilize a different, fast-growing African tree called Volcanga africana to synthesize pharmaceutical-grade ibogaine.
Oh, interesting.
And even further, the biotech industry is aggressively funding research into producing these complex alkaloids using engineered yeast and algae. The goal is to completely remove the environmental strain from the equation.
That supply chain shift is just a small piece of a much larger mobilization, though, because you have a highly effective treatment that carries severe cardiac risks, triggers a 36-hour hallucinogenic ordeal, and has a complicated ecological footprint.
Right.
That exact combination of massive potential and complex liabilities is exactly what brings pharmaceutical companies and federal funding to the table. Which brings us to the landscape of April 2026.
The field has fundamentally transformed. We are now looking at a robust, pharma-ready pipeline.
Pharma-ready?
Yeah. 6 major pharmaceutical companies are currently racing to reverse engineer the ibogaine molecule. Their objective is to create synthetic analogs that retain the neuroplasticity and the addiction-interrupting benefits.
But engineer out the bad stuff.
Exactly. Completely engineer out the cardiotoxicity and, in most cases, the 36-hour hallucinogenic experience.
And the financial and institutional backing here is just staggering. For example, a biotech company called Gilgamesh is developing a drug candidate known as GM3009.
Right.
They're operating with a $14 million grant from the National Institute on Drug Abuse, and they recently signed an option deal with AbbVie valued at nearly $2 billion.
$2 billion. It's massive.
You also have Dlx Therapeutics working on DLX-007, which chemically removes a specific structural ring from the molecule to protect the heart. And Equalis Therapeutics is developing Equal 101 with the goal of making it a standard outpatient pill.
And the policy landscape is moving just as fast as the pharmaceutical development.
Absolutely.
Just looking at the facts on the ground, as of a few weeks ago, on April 18, 2026, President Trump signed an executive order directing $50 million in federal funding specifically toward ibogaine research,
while also ordering regulatory agencies to establish a right-to-try pathway for suffering patients.
Exactly. And that federal momentum really mirrors significant state-level investments, too.
Yeah. Texas recently finalized a $100 million state initiative to fund clinical trials, which was an effort heavily championed by former Governor Rick Perry.
The advocacy from the veteran community has turned this into a notably bipartisan legislative priority. It's really something to see.
Just looking impartially at the funding landscape, yeah. But there's a catch with the pharma route, too, right?
Yeah. Leah Mix from the Ibogaine Healthcare Policy Institute cautions that getting a synthetic analog through FDA clinical trials is only one part of the equation.
Right.
She describes a massive adoption mode, meaning FDA approval does not automatically integrate a new treatment into the healthcare system.
Because you still need insurance billing codes, specialized hospital protocols, established frameworks for medical necessity.
And all of that takes years to build.
And because building that infrastructure takes years and people are dealing with life-threatening addictions and traumas today, some advocacy groups are actually taking an alternative legal route right now.
Right, the religious pathway.
Exactly. Justin Lepre, a former Marine, founded an organization called the Illuminating Collective. They are utilizing the Religious Freedom Restoration Act, or RFRA, to legally provide Ibogaine ceremonies in the present day.
Structuring their work as a sincere religious practice, rather than waiting for the FDA medical pathway to finalize.
So what does this all mean? Looking at this massive pharmaceutical push to engineer out the hallucinations, it brings up a crucial question. Go for it.
If pharma succeeds in creating a safe, non-hallucinogenic daily pill, don't we lose the deep psychological processing that makes this intervention work in the first place?
That is the big question.
Right, because the Bowitti tradition uses it specifically for introspection. The veterans in the Stanford study use that waking dream state to process their deepest traumas. Can you really separate the chemical reset from the spiritual psychological journey?
I love that you brought that up because that question represents the central tension of the entire field right now.
Is it just chemistry?
Right. We are attempting to distill a profound, deeply challenging 3-day rite of passage into a standardized outpatient medical therapy. Will an analog that simply triggers neuroplasticity be enough to cure a complex, deeply ingrained addiction if the patient never has to consciously face the underlying trauma?
We don't really know yet, do we?
The reality is, we simply do not have the long-term clinical data on these new synthetic analogs yet to know the answer. We are watching a massive societal and medical experiment unfold in real time. We really are. I mean, we started this deep dive in the rainforests of Central Africa with a sacred ceremonial route.
Yeah.
We followed its accidental discovery by a 19-year-old in 1962, looked closely at the cutting-edge brain network scans of special ops veterans at Stanford, and ended up right in the middle of a billion-dollar pharmaceutical race in 2026.
It's an incredible timeline, and the consistent reality through all of those eras is that this substance demands respect.
Absolutely.
Whether it is administered in a traditional ceremonial setting or a modern hospital ICU, it is not a magic cure that does the work for you. It provides an incredibly powerful temporary window of neuroplasticity. But the individual still bears the responsibility of integrating those insights and actively rebuilding their behavior.
The intervention gives you a clean slate, but you still have to write the next chapter. And that brings me to a final thought for you to consider as we wrap up today. If a single, intense chemical experience, just 36 hours out of an entire lifetime, has the biological power to completely untangle decades of our deepest traumas and our most stubborn destructive habits.
It's wild to think about.
It really makes you wonder how much of what we consider to be our unchangeable personality or our permanent damage is actually just a temporary pattern of brainwaves.
Wow.
Just a locked firewall waiting for the exact right signal to finally shift.
It forces a complete reevaluation of how we view the permanence of human suffering.
It absolutely does.
Yeah.
It suggests we might all have a factory reset button. We're just finally learning the science of how to press it safely. Thank you for joining us on this deep dive. Stay curious.